Well, good afternoon, and thank you so much for joining us on GPA Live. This is the virtual education series brought to you by the Global Pain Association. I'm your host, Ron Aaron Eisenberg. Delighted to be with you. We've been doing this for many months now and have well over 75,000 people who tune in every week to hear the latest in ways in which we try to help people with chronic pain, how to manage their medical life. And we are today welcoming to GPA Live a wonderful topic. Is the doctor in, or what should I look for in a primary care physician? And how do you find a support group? Our special guest, Dr. Marianne Pinkston, she's no stranger to GPA Live. She's a pain warrior herself and the moderator of the GPA Warriors, the Global Pain Association support group. And we're going to tell you a little bit more about Dr. Pinkston in a few minutes. But I want to introduce first the president and founder of the Global Pain Association. Please welcome Dr. Susan Blackwood. And Susan, as always, it is great to see you. Thanks.
And thank you, Ron, and to the Eisenberg Group for producing this each week. It's been amazing how many people we've been able to reach and help. This has been a resource for this community since 2018. We can't thank you enough for helping do the pivot during the pandemic and help us go virtual, because the series has been amazing. And we're looking forward to Dr. Pinkston's presentation today. For some of you that were tuning in because you thought we were going to have a little bit on foot pain and neuropathy, we've had a slight postponement on that one. And Dr. Pinkston's presentation we've been planning on for quite some time, and I'm glad you're going to get to participate in this. Global Pain Association started as a in-person event in 2019. And in 2020, we were able to start this series, and we can't thank people enough. We'll talk about some of the other resources that we have later in the show. But Dr. Pinkston is also the person that runs our support group the first and third Tuesday of every month at 7 p.m. through Connectability. So I know she's going to be mentioning that and talking about how people can get on and network with their fellow chronic pain sufferers.
And for folks, Dr. Blackwood, who want to learn more about the Global Pain Association, they can go to the website or they can email info@globalpain.org.
Absolutely. We're here for you, and we are anxious to hear some of the next presentations coming up in the next few months.
And Susan, we will talk to you after Dr. Pinkston's presentation, so stick with us. You're going to learn some things about how to pick that PCP, where to look for that new provider. If you have to make a change, how do you do that? And other questions that come up with primary care as well as medical care in the world in which we live today, because things, they are a-changing. Dr. Pinkston, by the way, is the owner of Pinkston Medical and Wellness Clinic. She's in family practice and integrative medicine specialist. She's also a board member of the Global Pain Association. She herself is a chronic pain warrior. You wouldn't know it looking at that smiling face, but she struggles with rheumatoid arthritis, and man, can that be painful. She's a facilitator, as Dr. Blackwood mentioned, of the new GPA Warrior Support Group. She also is an expert in hormone replacement. She's a specialist in weight loss and runs a program that she herself lost 162 pounds while struggling with chronic pain. And you wouldn't think that's possible, but she did it. And Dr. Pinkston, this is a great topic. It's something you wanted to talk about. Tell me about it.
Absolutely. Thank you first and foremost for having me on again. You know, it's always a pleasure. I love doing this. So yeah, this is a great topic because I think the face of medicine is changing, and it's changing with technology. It's changing in the face of what a PCP actually means. You know, I signed up for insurance myself not too long ago and was assigned a PCP. And traditionally, we know that as a primary care physician. And I found that it was a nurse practitioner, which is fine. They're very good. But that was a primary care provider. So that really shocked me because I've noticed that my HMO numbers and the patients that, join me and my practice or assigned to me are starting to drop a little bit. And so I thought, hey, that kind of tuned me in that there's something changing there. So, we can expand on that a little bit as well. And, but yeah, the face of everything is changing in medicine. So I kind of, spoofed it a little bit and said, is the doctor in? Because really you don't know, how this is going to go anymore. You used to, I came from a small town where my doctor lived 2 doors down, and, we knew everybody. It was cash pay. It was very easy to get in. And now there's so much corporate medicine going on. And so with the state of medicine, I put there the algorithm solution. It is my fear and my thought and my theory that doctors, as we know them, are going to be obsolete in the next decade or two, maybe 2 really, because I think that doctors will play more of an administrative role, and that we will have more of an algorithm-based or guideline-based, recipe-based medical care, in that, you go in, you've got only so much time because we're trying to be more efficient. That's more cost efficient. And that, there's a set of checklists, and do you match this checklist? If not, you go to this algorithm. Do you match that checklist? And then there's your treatment. Here you go. Goodbye. And patients respond to that to me all the time and tell me that they are so tired of just feeling like they're there for a couple of minutes and a prescription's written and they're out the door, that the art of medicine is lost. So that art of medicine is having a patient in front of you and taking the time that's needed and listening to that patient, and then applying different science-based, evidence-based principles, applying different thoughts and theories and listening to them and putting it together for their personal treatment. And that seems to be disappearing widely. And I'm very concerned about that, because now that, and again, I have nothing against nurse practitioners, or now what they call physician associates instead of physician assistants. I have nothing against that. That worries me. And I know that insurances feel that, the providers are, alternative providers are probably a little bit more inexpensive, liability wise, a little bit less. And they, kind of follow some of the directions and algorithms a little bit more easily. And doctors are hard to work with. We're kind of little children. We fight the system a little bit. We're rebellious in a way. And so I feel like we're being ushered out and shown a more administrative role than, being able to sit in front of patients anymore and practice the art of medicine. Not only
what can
that,
we, Dr. Pinkston, do as patients to buck that system?
Mhm.
How can we find a, quote, real doctor? Not that nurse practitioners aren't great,
Right.
but they're limited in terms of what they can do, and they have to be supervised
Yes.
by a physician anyhow. So how do we get around that?
I've got a lot of experience like this because I have hired nurse practitioners before. In fact, I had one nurse practitioner, Gina, I'll mention her. She was wonderful. She was my mini me, she was my sidekick, and I taught her so much. She was with me for so long. So she was very capable. So nurse practitioners can be very capable. But I think when you're looking for somebody, it's more than, we just get assigned somebody. We just get, we get into a corporate driven algorithm, like I say, and sometimes you need to just go back to that word of mouth, learning. That's where most of my patients find me. I don't really advertise. A lot of patients come in and say, oh, my sister said you're great or whatever. And they'll tell me that they're sent in by somebody. And that's how I find most of my patients that way. I don't really go much by insurance, the kind of any, meeny, money, mo type of, assignments. I do have a lot of that, but I really do care about the patients who come in and try to keep applying that art of medicine. I'm one of very few solo practitioners that are out there. Most practitioners are bought up by the system and eaten up by the insurance industry or the hospitals. And that is a very difficult system to fight.
But it's very seductive for the doctors. The billing is no longer an issue. They don't have to worry about all kinds of issues when they get bought up. But it does change, as you're pointing out, their practice.
It does immensely. And I would never in a million years, believe me, I've been approached by so many companies and businesses to buy me out, and I will not do it. But I tell you what, I'm getting very, very tired. And that's what I mean by doctor burnout. And I think that's what happens to a lot of physicians when they fall into those roles, is that we are really hammered. There are so many rules and regulations, and the insurance industry has just clamped down on us. We cannot practice what we think is right for a patient. We only have so much money to spend. We have formularies we have to follow. I mean, what I feel is right for my patient can't be done. But I fight. I really fight them. And I think, again, that's why they don't like doctors so much, because we tend to fight. And that is something you have to do. You have to be an advocate for your patient. The Google factor is something I mentioned here too that is beginning to bother me a lot, because I've noticed a huge trend of patients who come in with a preconceived idea of what they want to accomplish in their health. I hear so many times, Dr. Pinkston, I've read and I know my body, and this sounds like me, and this is what I want. And if I don't really cater to that, they get very upset and frustrated. And I really have a battle of almost a lack of trust. I'm not sure what it is, and I'm trying to figure that out, because I've got to overcome this in my practice. And Google is great. There's a lot of great information, but you've always heard that a little bit of information is very dangerous, and it is. I've done this for 25 years, and not only did I go to medical school and residency, but I've also put about 15 years and probably more than $20,000 into a whole other education. And with my 25 years of experience, believe me, what's on Google is not what you need to know about your health and what you need. So,
well, I can share with you a situation involving veterinary medicine. Our dog for a couple of days was having difficulties and was tripping and falling down. And I Googled it, and I came up with Wobbler's disease, which is deadly.
mm-hmm.
Took her into my veterinary clinic. I walked in and I said, I think Lucy has Wobblers and she's going to die. And they laughed and said, "You looked it up on Google, right?" And I said, "Yes." And
Yes,
they
I did.
said,
Guilty.
"She does not have Wobblers."
That's
And
correct.
she didn't, of course. I was convinced she did. And I have really stopped using Google as my primary source for medical information.
Thank goodness. You know, I really respect that. I respect that there's information and it helps to guide you. It's a tool. You know, it can be very helpful and very important, but I promise you it cannot go up against that MD and experience on the back of my name. And there are situations where patients are very unhappy with the situation they're in, maybe with the doctor or practitioner that they have, or the corporation or whatever. And you need to just realize you can fire your doctor. You can fire your provider. You can go find what you need. There are still doctors out there who care very much. And I need to be careful about that, because I don't think that just because it's not working out with a physician that they don't care about you. I think all doctors care, really. I think everybody's different on how they approach things, but they also work under different rules and restrictions. I'm a little bit more rebellious and loose because I have that ability, as it being my own practice, to do those things. So the payment in that is you wait a little bit longer in my waiting room sometimes, because I don't burn and churn people out. But that's usually very appreciated. Not everybody likes me either, and that's okay. I can't please everybody. I don't want to please everybody. I just want to do what's right. And if you're not happy with how we're doing it, it's okay. Go find what works for you. And that's very important for patients to do.
I want to follow up on that. I want to throw a question out at you that a couple of our viewers have put into the chat room. One is Elizabeth says, health insurance is preventing me from getting the care I'm assuming she says that she thinks she needs.
Right.
Can you fight the insurance company?
Oh, yes, you can. And that is what people don't understand, that it's kind of hard to pinpoint. And we certainly don't have a lot of time to do it, but really, I think that you need to understand you can also fire your insurance company, and you may be under certain restrictions. You may be at a certain job where that's all you have, or, a disability and that's all you have. But, you need to align with your provider. And if your provider really is willing, to fight the fight, I can get medicines and tests and things that I need. It takes a lot of time and effort, and I try not to let that take away from other patients, and I have to do it outside of hours sometimes, but I'm willing to do it because I agree with you, Elizabeth. It is hard to get your insurance company. They feel like they're the boss and that they know it's best. Really what it is that they're trying to cut costs and they're trying to make it more efficient so everybody has access. So when everybody has access, you have to make certain rules that everybody kind of has to follow. But that's not easy when it comes to healthcare, because not every patient can just follow a guideline. Not everybody can follow the same algorithm. People are people. They have their needs. So yes, it can be done.
So how do you find a fighter for your PCP? What are the kinds of questions? You have an advantage as a physician to know the kind of questions to ask, because you're not your own provider. It's like a lawyer having themselves as a client. How do you choose, and what are the choices, and what do you ask that doctor?
You know what? I think you can understand some things by looking at websites. You go to my website, for instance, and I'm a female. If you want a female, well, then there's one check off the list. You can also see that I own my own business and I'm not a part of a huge corporation. You can call and make sure I'm on your insurance. You can you can look at my story and you can see that I do things alternatively. So you can shop a little bit. Really, there's so much information. That's where Google does come in handy. You can shop a little bit. You can also ask people. I think the best way of finding a great doctor is to ask somebody, who do you go to? Who do you like? What kind of care do you get? And that is the best way to know. And then just ask if they're on your insurance. And sometimes that can be a little bit tough and restrictive, but there's others out there. You're not confined to just one person.
And then when it comes to specialists, doctors generally will refer you to a specialist who you know nothing about.
Right. That's huge. In my tradition, will only send patients to people that I would go to. And it's not that I think that certain doctors are bad or whatnot. I think it's just there are certain ways of doing things that I like and agree with, and therefore I choose physicians. Also, I personality match a little bit, and they have to be on your insurance. So sometimes I'll choose a doctor that I think is good for you, and then they're not on your insurance. And then we kind of have to go back to the algorithm and just choose someone. But most of the time it works out just fine. And I can personality match a little bit. I can read a patient, know what their needs are, and think, you know what, this Dr. So-and-so would be great for this patient. Or if I know what their skills are, maybe this doctor has a niche. Again, you can also ask people around you. There's somebody who just had surgery, last year. You can ask that patient, did you like that doctor? Is that somebody I should go to? That is a good way of finding somebody you can rely on.
And when you think about the kind of questions you ought to ask, you put on this list, what if I disagree? Can I ask a question? In the old days, we put you doctors on pedestals.
Exactly.
What you said, we honored and never questioned. That's changing, and I think that's a good thing.
It's a good thing and it's a bad thing. And here, I think that there is always an extreme. So the extreme of the doctors, where you couldn't ask anything, is not good. And I think that other extreme of having all control yourself is not a good thing either. I think that like everything, moderation is the key. And I think you need a physician who will at least listen to you. And if you ask questions, will answer your questions and not feel threatened by that. But I can tell you many times I disagree with what a patient's asking, but I guide them and I tell them that, this is why I understand what you're saying and I can see. So let me tell you why I feel that might not be best for you. And this is why I want to do what I want to do. That just takes an incredible amount of time, and it takes an incredible ability to communicate. And these days, insurances tell us we've got to see 40 or 50 patients a day. That gives me 5 to 10 minutes with somebody. It's hard to do that. So, you got to find a doctor that'll balance that with you and not be threatened by that. But patients need to understand, you are in charge, but you also aren't. You do need to still let me be your doctor and still let me have that authority and control in a way.
You happen to be a female. When folks choose a doctor, Should they think of differences between male and female providers?
Oh, absolutely. And I make the joke with a lot of my patients, because some patients will come in and say, I just, I have to have a female doctor. I feel like they communicate better. I feel like they listen better. And I think it's a nurturing quality for females to have. There's a downside to that too. And sometimes you need somebody who's a little bit more strict and thinks a little bit more practical and logical in a way like males tend to do. Females sometimes can go out on pregnancy leave. Their hours are shorter because they have kids at home and things like that. So there's always the ups and downs. But I tell you that, I have and the joke that I was referring to is that I have a couple of male doctors that are in the female club. So they are able to be nurturing, even though they're male. And I think that you can't always judge a book by its cover. Just because you're male, you're this, you're female, you're that. But I think everybody knows not to overgeneralize. But I do think that you have to look at those different qualities in men and women. And that does show in how we practice.
Now, there's some additional questions in the chat room, and Elizabeth has a follow-up. And if you don't mind, Dr. Pinkston,
Sure.
Perhaps she can call you off the air and you can talk with her about her issue rather
Absolutely.
than taking it up here. Would that be okay?
That would be okay. I mean, you can easily find me on Facebook, although we shouldn't talk about personal matters in a chat room anywhere or online. But at least we can hook up and get in touch with each other with a good way to do it encrypted or wise. And I am happy to help. Absolutely. So either hit me up on Facebook or an email.
And if you're in the chat room, please share this so that others among your friends can tune in as well. We encourage you to do that.
Yes.
Now, Global Pain Warriors, we have mentioned it on a couple of occasions. It is a support group, Dr. Pinkston, that you happen to moderate. Tell us about it.
I am so proud of this role that I have been honored to be given. Yes, it is a support group. So I know everybody's going, oh, support group. And, I see a lot of that in patients' eyes when I talk to them about it. But this is really a very legitimate area where you can get true support, where, I think patients think that they have to have just chronic pain in order to join this group. And they don't even have to be patients. It can be friends and family of somebody who has chronic pain or somebody who even passed away years ago, and they're still suffering some of the guilt and thoughts of somebody they took care of. I mean, this opens up to so many different areas of people that can join in. It is free. So you don't have to pay anything. It's short so that, we don't go on and on forever, and we spend enough time with you as you need, but we don't overdo it. So you're not going to have to invest an entire evening. It is the first and third Tuesdays of the month, and you can find us through globalpain.org. It's from 7 to 8 p.m. And it is something that I want people to understand that, we, and true, something that's important as well is we are about to go live with this. So we're actually going to be live and not just on a Zoom. So if that's not comfortable for you, you can go to a live meeting in the near future in August, but then we will also carry it on Zoom. So if you're not comfortable with that, we will be in both aspects. But we are very accessible, and we are here to try to help you find some solutions to, if you have chronic pain, to any of the questions that you have, to any of the obstacles that you come across, but also to educate and counsel and support. And I think that is a huge tool in the community that is underutilized at this point.
And I want to come back to something that you said early on. If you happen to be a chronic pain sufferer, it's important that your primary care physician understands what that means. Not everyone does.
Right. Not everyone does. That is, you can't say it any better than that. And I guess when I think back, I've had rheumatoid arthritis for almost 15 years now and battled it terribly. I think that in some ways it has been somewhat of a blessing. It has allowed me to come, it's humanized me. It's made me a lot more empathetic. It has brought me to a place where I can really understand what people are going through and push a little farther to try to help. I'm always glad to do so. I'm always glad to find other doctors that can help you as well. And so I take that as a as something to be happy about instead of something to be upset about, because pain is a horrible, horrible thing. It comes from so many diseases, so many different directions. So it's hard to quantify and put it into a little easy box and deal with it. But the thing that we all share is that it hurts, and it affects your emotional abilities, affects your physical capabilities, and your ability to be social and have a normal life, and affects your quality of life immensely. So those are the things that we can talk about and address in a support group and in a clinic as well.
Now, what haven't we asked you that you want to share with our viewers today?
I don't know. I'm terrible at jokes and punchlines. I don't know the winning lottery numbers, or so I'm not sure. Really, I just think that I really want patients to understand that they still do have power in this world that's of high technology and more corporate medicine. And you can reach out to me anytime. I do take insurances. I do take cash patients as well. I do have a podcast, and I am on YouTube, and I have a radio show. If you will go to drpbetterlife.com, you can find all of those links to podcast, YouTube, and Sundays on KLUP. That is AM 930. At 4 p.m., I am on the radio here in town, but you can reach us at 210-698-7825 at Pinkston Medical and Wellness. And I invite anybody that wants to come. Please contact me.
Well, Dr. Pinkston, I want to thank you so much for joining us today and the information that you share. We could do this for another 2, 3, 4 hours, because for so many people, the struggle to find the right primary care physician and the right specialist is daunting. And you have to really remember what you said. You can fire your doctor.
Mm-hmm. You sure can. Even I've had trouble finding the right doctors. Luckily, Dr. Wickersham, who is one of our board members, has been my doctor for the past 10 or so years, has taken good care of me. So, it's very important that you find that good doctor, and I understand that completely.
Now, he's a rheumatologist.
He is a rheumatologist.
And if you have rheumatoid arthritis, you need a rheumatologist.
You need a rheumatologist, that's for sure.
Well, Dr. Pinkston, thank you so much for joining us. We really, really appreciate it.
Thank you.
And for all of you in the chat room, again, please share, and others can watch this as well. Marianne, we thank you.
I'm happy to.
I'm sorry?
I'll go back. I'm sorry. I know she took me down. I'll go back and answer some questions.
Okay, cool. Thank you.
Right. Mm-hmm.
I want to bring Dr. Susan Blackwood back on as president of the Global Pain Association. And Dr. Blackwood, always, Marianne does a great job.
Always has a very interesting perspective, something that we don't normally think about. And given her experience and background and that sort of thing, she's really amazing in terms of her perspective and insight. So we really appreciate her coming on and giving us some little tips. I'm in the process of changing doctors just because our doctor is moving to a different practice and not as convenient. And so even though that's not as valid of a reason in terms of some of the other things that Marianne talked, it still haunts you when you have to go to somebody that you haven't, been to or relied on in the past.
So how do you find a new doctor?
Referrals. I think that's really the best way, knowing people that are similar in terms of your values and tastes and that sort of thing, and see what they would recommend. And we've had several and we've explored it. And so I think she's right on in terms of trying to find somebody that matches your personality, your needs, and the kind of help that you need, basically. I mean, I think that, doctors have different expertises, and certainly the PCPs are, going to send you to an expert, but finding somebody that knows your needs and wants is really important.
So tell us how folks can get involved in the Global Pain Association.
Well, there's so many ways. They go to our website, globalpain.org. They can either donate, which we would appreciate because we want to keep this series going. And hopefully in the fall, given our board of directors direction, we'll have another in-person event if we'll be able to raise the funds to be able to do that. No donations too small. So if they could do that, we'd appreciate it. They can go to that website and volunteer. They can sign up for our newsletter so they get more information from us. We try to use Constant Contact to send information out weekly about the series and about the Global Pain Warriors. And we can't we can't get enough information out. Our website is so resourceful. So if people would just go to the website and look on some of our community resources, the calendars that we publish and that sort of thing, I think they'll be well informed.
Dr. Blackwood, thank you so much. Anything you want to add?
No, just want to thank you all again for putting this on weekly. I know it's a big task. People don't understand about the practices during the week, the run-throughs the day before, all the anxiety that you go through with this technical world that we live in. So I want to thank you again. And it's a big sacrifice on your part, and Global Pain Association couldn't be here without you.
Well, it wouldn't happen without my wife, who is our executive producer, Gina Galavis Eisenberg, and we have to thank her for putting up with all of us and all the trials and tribulations. Doesn't hurt that she spent a lot of years as a television news reporter, so she's used to dealing with issues that come up out of nowhere. And thank
Raising
you, Susan.
3 kids is probably giving her a little experience too.
Having 3 kids would give everybody an experience. Thank you all for joining us next week on GPA Live at noon, right here on Facebook Live on the Global Pain Association Facebook page. Next Saturday, July 31st, here on GPA Live, we talk about fitness with chronic pain. And it may sound like an oxymoron, but if you have chronic pain, you need to get up, get moving, get out of the chair, and fitness is what it's all about. We'll have a live demonstration with Daniel Rubalcaba of ALIO Fitness Club. That'll be next Saturday on GPA Live. Thank you all for joining us. Have a great rest of your weekend, everybody. Bye-bye.